புரியுது. Hey, don't cry. Small problem, Babu. What is this? தெலுங்கு தமிழ் தெரியுமா? பிரச்சனை இல்லை. தெலுங்கு மீடியம். தழும்பையும் எடுத்துடலாம், கோணலையும் எடுத்துடலாம், நார்மல் ஆக்கிடலாம். அதுக்கு பிறகு ஒரு 3 வருஷம் 20-21 வயசு ஆறவ இதில் வந்து நம்ம மீசை வச்சு விடலாம். அப்போ பர்ஃபெக்ட் ஆயிடும், யாருக்குமே தெரியாது, உங்களை மாதிரி இருக்கும். புரியுது. டோன்ட் கிரை. Small problem, Babu. What is this? Don't cry. What happened? இது சொல்றாங்க. இது చెరుదు problem. That's very sad because the mom says that the guy doesn't even leave home and he's upset all the time. So we're going to get this thing sorted. It's not even a major surgery. It's not even a complicated one. I think I should be able to sort this out maybe in 45 minutes. And also he's not going to have any scar. We're going to show you his recovery probably if he's willing. And after that, we're planning to put some moustache if needed a few years later. Even that he may not need is what I'm thinking, because we're going to give the correct shape to the lip. This is not a scar from any other earlier surgeon's surgery or anything. This is what we call as nature's union. It's a variant of an incomplete lip which has a scar all the way up, and that's called a microform. So even if it's looking like a scar that was operated, but the reality is this is going to be this first surgery, and I hope the last. ये दाग दिख रहा है ना, वहाँ पे भी बाल लगाएगा तो सुपर हो जाएगा, किसी को मालूम नहीं होगा. वो नाक सर्जरी के टाइम पे भी कर सकते हैं, आपको चाहिए तो. मम्मी से बताओ. हाँ చేసేచ్చా. I know Telugu. You talk to me in Telugu, I'll tell you. I can understand.
అదే ఇది చేస్తారంట, అప్పుడు ఇది కూడా పెట్టేసుకోవచ్చా అని అడుగుతున్నారు. ఏం చేస్తాం?
ಬಿಯರ್ಡ್ ಲೇದು ಬೇಡ, ಇದು ಮಾಡ್ಬೋದು, ಬಿಕಾಸ್ ಇಲ್ಲಿ ಬರೋದಿಲ್ಲ. ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್. इनका पहले का फोटो लेके आओ. कुछ
చాలా బాగా చేశారు సార్.
చాలా
బాగా చేశారు.
ఓకే, థ్యాంక్ యూ.
అంటే మీ భాషలో
బాగా చేస్తా మీన్స్ ఇట్స్ కమ్ అవుట్ వెరీ గుడ్, రైట్?
நல்லா இருக்கும் சார்.
థ్యాంక్ యూ. పురియుது. Right, so we did lip revision for this guy. He's come all the way from Andhra Pradesh, and I remember them because I understand Telugu to an extent. I can't speak back, and I had some issues trying to explain to him even 4 months ago. Yeah, that's him. They've got his before picture. Take a look at that. So you can see so we took care of the lip. You can see there was a scar, which was not the real main issue. His teeth was visible because there was lack of muscle. There was extra muscle there, and there was a notching. I've also improved the nose a little bit. If you see, the side of the nose was sticking out. That's gone back in. So he's very happy with the result. So am I, and his mom is also very happy. And she's got a translator now who can speak Tamil to us. That's a side view. We're going to try and show you this view also. Yeah, and you can look at this hairstyle. He's become more confident. Yeah, he's got a great hairstyle now. This is like the hairstyle my son sports also, like a mushroom, like a bomb exploding. Yeah, but that's where he's gone from this hairstyle. Look at his hairstyle earlier. So that's what a good lip surgery can do to you. Yeah, it even improves your hairstyle, everything. He's looking so much more positive, so much more brighter. Yes, so you can see this. Okay, you can speak Telugu or little Hindi, English. What? हिंदी मालूम है? तो बोलो अच्छा क्या क्या आपको लगा? हाँ? आप हैप्पी है ना? आपके दोस्त क्या बोला? अच्छा करे बोला आपका दोस्त. हाँ. आपको अच्छा करे लग रहा है? वेरी गुड. सो अभी क्या करना है आपको?
ये थोड़ा.
हाँ. So now he wants that little bit more perfection to his nose as well. So we're going to do a nose job for him now. Well, if you look from front, there's not a big, it's not looking like a cleft issue anymore. But he still wants a much more narrower, more projected nose. And if you look from here, you can see the asymmetry. This is the issue. That's because the cleft, the attachment of the septum is onto the right side because it never attaches in the midline. The anterior nasal spine, or the place where the septum or the center part of the nose, the bony and the cartilaginous part for the cleft kids is not attached in the midline. That's one of the reasons why they have this tilted look, especially from underneath. It's pretty hard to correct because this cartilaginous transformation or the change that has occurred over 20 years as the child grows. Plus it also has a change that has happened in the alar cartilages. These are the cartilages that form the dome of the nose and forms the tip as well. So it might look like it's a small deformity, but actually it's much more difficult to correct this 3-4 millimeters of asymmetry, especially in a cleft patient. But we're going to do that for him. So you want ये जो अलग लग रहा है वो स्ट्रेट करना है, कुछ और करना है भी कर सकते हैं,
ये भी
वो करेगा शार्प, और ये थोड़ा नैरो करना है तब अच्छा लगेगा फेस में. आपका फेस नैरो है ना, तो यहाँ थोड़ा नैरो करेगा और स्ट्रेट, एंड ये
मेरे को प्रॉब्लम है,
वो अच्छा हो जाएगा. एसिमेट्री स्ट्रेट होना है ना, लिफ्ट करना है. So these days you see how kids are, they know everything. He wants what to be lifted, what to be made straight, and everything. So दांत भी करना है बाद में. एक छोटा दांत है ना, दांत, हाँ वो वहाँ मीट करो, वो दांत भी सही करेंगे, निकालेंगे नहीं उसको, ऐसा कुछ करके रेडी करेंगे. ओके. सो rhinoplasty. Right, so I've advised for him rhinoplasty with rib if need be, because of the fact that the septum is deviated and we can't use a lot of that deviated septum even if we harvest. So some amount of septal reconstruction is definitely needed in order to bolster that weakened bent cartilage. But we're also going to do the rest of the nose, like the tip and everything. I've also suggested him to go for a little hair transplantation here. The shape is nice, the white roll is nice, but you see the lack of hair there. This is because of nature itself. There is less hair follicles in some of the areas around the cleft. It's more in the bilateral, but even in unilateral you do have issues where the density of the hair follicles is less, and in this case it's really less. So we're going to just give that 1.5 centimeters of hair, so that scar also gets totally taken care of. And so we're going to get another person whom we've totally converted from having a cleft issue to a person who doesn't have that. Right, thank you.